Hello everyone. I am Dr. Bharat Saboo from India and I will be talking today about artificial intelligence in comprehensive metabolic care. As we all know, AI is slowly paving its way and this topic would be really interesting to all of you. First of all, my heartfelt thanks to the Egyptian Cardio-Diabetes Association and especially my dear friend Professor Noshi Yusuf for inviting me here and setting up this so very well. And this is really an academic feast for everyone. This is my conflict of interest for this talk. I don't have any financial disclosures to make. And this is a cartoon which will depict the future for us. When we will be seeing our patient in future, we will ask, who gave you the first opinion, Facebook, Twitter, or WhatsApp? So is this really the future of us? Let us see in next 15 minutes or so. This is a very beautiful read, Artificial Intelligence, the Future of Diabetes Care, which clearly depicts that artificial intelligence is so slowly going to pave its way into diabetes care, specifically metabolic care per se. This is my own review on impact of ChatGPT on enhancing healthcare in India, and this is actually thing which is coming slowly into our day-to-day lives, the ChatGPT or the generative artificial intelligence. Now, going into the detail of artificial intelligence, how it have a triple play in healthcare, let us see what are the impact it has. It has a cost impact, which is directly there because it reduces the need for customer care executive, it reduces the cost of population health management, and reduces medical loss ratio. Then there is an operational impact also because it can accurately diagnose rare genetic disorders, it can personalize medical care for patients, collate and analyze healthcare data in silos which are otherwise in pockets and we cannot analyze it. And then there is a business impact which creates distinctive healthcare solution. It increases healthcare savings and enhances member-patient experience. Now, how AI and machine learning can impact healthcare? We all know AI and robotics can help us in keeping well, can help us in early detection, can help in diagnosis, decision-making, treatment, end-of-life care, research, and training as well. Now, what is digital health? Because this is again a new thing which is coming up. A digital health consists of wearable or implantable, which is usually a sensor, which is wirelessly communicating with a smartphone to receive the information, and a software which is there in the mobile. We commonly call it as an app to process the information. And digital ecosystem of data-driven tools, these link people with diabetes and their care teams, enabling the precision management of diabetes. This is how the patient will look like in future. They will be having headbands, earrings, patches, belts, body sensors, socks, and they will generate a huge amount of data out of it, ranging from heart rate variability, sleep, glucose, abnormal movement, weight change. All the things will be captured. The data will be sent to us, and then we need to analyze the data. And that is why the structure of digital diabetes ecosystem become important, because all these data which is coming to us constitutes the big data. It comes from wearable devices, publicly available data, electronic health records, social online data, and then there are digital therapeutic platforms which have embedded health intelligence. With the help and support of humans like us and machines and processes, they give a patient-centered outcome. The machine keeps on learning on itself, and they actually then generate dosing algorithms and treatment protocol. We all know that this is the future because these are all the determinants of diabetes care, which can range from the community determinants, where policy, government policy specifically, community-based organization and healthcare system come into play. Then there are individual determinants, where biologic, like genetic ancestry, we all know the behavior, diet, smoking, physical activity, and physical factors like age, race, obesity comes into play. And then there are interpersonal determinants also, which are social, access to care, telecommunication, and communication, system navigation, health literacy, and language barrier comes into play. Now, this is actually an overview of AI application in diabetes management, how this would be done. We will be screening or classifying the diabetes. Then we will be quantifying the lab test values. Then we will segregate population without diabetes and with diabetes. And with diabetes population would be given health education, nutrition therapy, physical therapy, blood glucose monitoring, and drug therapy, while population without diabetes would be just about prediction of diabetes onset, recognition and management of modifiable risk factors so that we can prevent a diabetes to occur. And then there would be third subset of patients which will have diabetic complication, where we can screen for complication, recognize referable patient, and prediction of progression as well. Now, moving forward, this is how it will look like. The data from our devices will be actually sent to the centralized server, where also the electronic health record will come. And then clinician will look into this data. They will label or monitor the data. AI will assist a clinician into this. Then they will do data analysis, teleconsultation, and communication between visits. And then we will do the same thing which I've talked about regarding population with and without diabetes. These are all the data sources I told you. It can range from genomics to physical activity, dietary intake, geospatial data, social determinants of health, medical devices, healthcare utilization, all those things. They can be used in screening and prevention, diagnosis and treatment and management of diabetes and related complications. Now, where does actually AI helps in diabetes? AI is very good in image processing. It is very good in pattern recognition and very good in predictability also, because it is an ability to analyze the big data which human brain is not able to. And it can extract meaningful information from surrogate markers. Now, AI in diabetes can help in hypoglycemia prediction, insulin management, personalized OHA recommendation, personalized diet, I would say, patient education, and target organ assessment. Let us see use cases one by one. This is a very common thing which we all use in our day-to-day practice. This is nothing but a fundus camera, where AI has a high sensitivity and specificity in detecting diabetic retinopathy. And this is how first AI came into our clinics. We all know AI has a better image processing ability than the human vision, and that is why they are being used to process the foot images, the SPECT, the retinal images, and even the electrocardiogram, and they do better than humans. Now, hypoglycemia, look, this is actually an app which is telling me that looking back, I see that your sugar is often below target between 12 p.m. to 3 p.m. on Saturdays, and you might be doing something different at that time. And I will keep an eye on the pattern during this time as I get more data. So they know that what happens on Saturday, what happens on Sunday, Monday, and what time of the day. And that is how AI can help us. And this is a Sugar IQ app by Medtronic. It gives a hypoglycemia prediction 4 hours before occurrence of hypoglycemia. It requires CGM and shares data automatically with the healthcare provider. This is again a IQ cast, which is saying that you are expected to experience a low within the next 2 hours. This is an app which is telling just by doing pattern recognition and prediction. And this is how it is done. In predictive prevention and insight, it actually does it by doing a threshold alert, because threshold alert cannot avoid hypoglycemia. We are alerting when the threshold is reached, but the predictive alert can reduce or prevent hypoglycemia, because it will act before the actual occurrence. And how much before? It actually works, let's say, around 2 hours before the actual occurrence of hypoglycemia, based on the pattern it reads. Closed loop hybrid pump, we all know, is a revelation. It changed the lives of our patient. This is again a marvel of artificial intelligence, because it intelligently predicts the glucose trend. It gives the hypoglycemia alarm and insulin infusion suspension function, which is done automatically. And it again determines the correction bolus also for our patient. This is insulin dose adjustment for patients who are not on pump therapy. There is a decision support system which do adaptive tuning of bolus calculator parameters. It predicts glucose after putting in the dose, and it helps in ensuring optimal insulin dosing and smart alarms. This is a revolution. AI-powered digital endocrinologist known as DREAMET. It is a US FDA approved for type 1 and type 2 diabetes patients on insulin, and it has not been proven inferior to endocrinologists for glycemic control and hypoglycemia. And it just takes 20 seconds to generate recommendation. Wow. Now, AI-enabled precision medicine is also coming in. We all know we have subclassified diabetes based on clusters, genetic susceptibility, metabolomic profile, gut microbiota, lifestyle behavior, physiology, and refined glycemic phenotyping. And on that basis, data-driven clusters are prepared. And they actually help us in treating the patient right, because a patient can respond normally to a normal dose, can respond to a lower dose, can need a higher dose to respond, and can respond to alternative medicine. That is what the future is, precision medicine. Moving forward, we see in personal nutrition. That is again one more thing where the artificial intelligence is paving its way, because the glycemic index was the thing of past, because now personalized medicine has come up, and two different glycemic index for the same food is possible for different person, because it depends on so many data which is in and around that person. And once the machine learns the pattern at community level to classify food into good and bad with fecal microbiota sample and thermometric data and basic genetic analysis. And this is what it does. What is food to one person may be poison to other. Maybe Professor Noshe is eating something and it is suiting him, but me, Dr. Bharat, eating that thing, and I'm getting a spike in my blood glucose values. And that is actually where AI will help us in deciding one-on-one what is good for me and what is good for Professor Noshe. Now, again, in patient education, behavioral intervention, it can actually reduce HbA1c. It can reduce the carb in the meal by just making patient aware, and it can add 35 minutes of additional activity per week to patient if they do it right. ECG is one thing where AI is definitely in. This is beat logic, which is gold standard clinical validation, and feature extraction function may confer high specificity and sensitivity. Look at this, beat detection more than 99.7%, AFib sensitivity of more than 96%, and VT sensitivity of more than 97%. We are all almost having this, isn't it? This is Apple Watch. This gives you the heart rate, AFib, and ECGs. And this is a study which showed that prediction of 10-year cardiovascular mortality was very much possible with the help of artificial intelligence. These are all the parameters which a ECG has. And human eye, I don't know, may miss one or two, but AI doesn't miss anything. And it actually does very good in blood pressure also. Combined with low-cost wearable device, such as method used to have potential to monitor for continuous, non-intrusive, cuffless, and wireless remote BP, it can actually alert the sudden rise in BP of patient immediately and provide accurate treatment. These are all the data, ECG data, which contain significant predictive information. But the problem is we are not aligning it with the data. Once we are able to align it, we will be better able to know that what ECG pattern can cause what in future. Now, AI offers significant rate of remission for type 2 diabetes compared to standard care. This is from ADA. And this was a paper which was published. This is type 2 diabetes reversal with digital twin technology, enabled precision nutrition and staging of reversal. And this is what? This is actually reduction in HbA1c levels from baseline to 90 days of follow-up in patients adhering to the twin precision nutrition. This is again the percentage of patients which reach target HbA1c after 90 days, it's around 40%. PCR. This is a very beautiful thing. It is a machine learning and IoT-based smart health platform for overweight and obesity control. It is used in elderly people with obesity, where there is actually smart scale and other wearable providers which directly communicate with doctor, family, and nurse. And on this basis, the recommendations are given, the food is charted, and all the things are done to reduce the obesity. This is an endorsed feasibility study. It explores the use of mobile health, artificial intelligence, and serious games for management of childhood obesity. And it was found that this works wonderfully well. Predicting obesity in adult using machine learning, analysis of Indonesian basic health research, 2018, application of AI to obesity research, because there is next thing which is coming up, which is obesity, and all the focus is now shifting towards obesity, and AI is not left behind. This is again digital pathology with artificial intelligence, which analyzes and provides greater insights into treatment-induced fibrous regression in NASH, MASLD these days. And actually, this can predict MASLD much earlier than the prediction which we are doing right now. Now, AI predicts the progression of diabetic kidney disease using big data machine learning. You can clearly see it has a 93% actually predictive value for low risk, and positive predictive value for high risk is 69%. Again, combining AI and footwear, it improves diabetes care. We all know this is how the sole will look like. It would be a digital twin model, water resistant, all the metrics on the foot pressure, Bluetooth and smartphone connection, and data would be remotely monitored by the doctor. In diabetic foot ulcer, we can predict the foot ulcer by thermal imaging and analysis of the data, wound assessment by taking a serial photograph, and suggestion for appropriate footwear can also be given. This is again a very beautiful thing. The AI model enables earlier detection of diabetes through chest X-ray. Who thought about this? But AI is doing its wonders and it can be able to predict diabetes through chest X-ray. This is one more thing where the AI is paving its way and it is very useful. Now I can read a lot, not exactly 5,000, but I can read a lot new medical studies and still see patients just with the help of this software from IBM, which is IBM Watson. And it can help your life with research a lot easier. This is again a very beautiful read, Artificial Intelligence in Diabetes Management. What are the advancements, opportunities, and challenges? Go and read this. This is a wonderful read. Now, any other thing which carries positive, carries downside also. And this is actually the downsides of AI. There can be no data, like in developing countries like ours, India, people are seldomly putting data. Either they are putting biased data. The data quality is the issue because we all know there is a term which is garbage in, garbage out phenomena. So we put a wrong data in and we give a wrong output. Data labeling, potential software errors is an issue. The intentions of vendors are a big no in India because many vendors have failed in delivering what is there ethically. Variability in result from different AI system, physician training, acceptance and adoption is an issue. Now, how to improve diabetes care? Data is king and information is power, we all know. Human intelligence definitely needs AI to make sense of huge amount of data provided by technology. It can help in prediction of diabetes, selection of anti-diabetic treatment, prevention of hypoglycemia, even in target organ assessment, behavioral modification, quality of life improvement, prediction of a cardiac event, and treatment of obesity as well. So believe me, this is just the beginning of artificial intelligence. With this, I thank you all for the patient listening. With this quote of Steve Jobs, technology is nothing but amplifier of our intellect. Thank you. Thank you, everyone.